I'm just going to start with my introduction. Some of you might have heard it, so it might be repetition for you. But as my title says, I am a senior speech and language therapist. I work in Ireland. I'm also an app developer. App developer in the sense I work with a company which has developed the first app in Hindi for speech and language. It's called Meri that's the name of the app. I also work as a consultant for a lot of organizations, and I would like to, give away my expertise to try and do something good in this field. And I have recently started a teletherapy service, which means I can remotely connect with clients because the gap is huge. The number of speech therapists which are produced or which happen to be in India compared to the population which needs the services is a huge gap. Okay? Whether it is occupational therapy, physiotherapy, speech therapy, probably the same state with all of them. And if you want to get services, you want to get good services, you want to connect with professionals, the technology is really opening up doors to access these kind of services. I want to ask a simple question. How many of you sitting in this room do not have a smartphone? Is there anybody in this room who does not have a smartphone? Yes? No? Come on. Is there anybody who does not have a smartphone?
No. No.
You don't have? Or you have?
I have.
Okay, so most of us do have something smart in our pocket, right? A smart car, smart house, smartphone. What I'm trying to say here is when technology is entering every part of our life, why should it not enter the field of disabilities to support children who have communication difficulties? Why can't technology help them? And technology can help them in a very big way, and that's what I'm going to talk about today, how technology can help to deliver speech therapy or record their progress or have a goal that we can move on to the next level from where we are. So, looking at the healthcare crisis, I was just looking at the statistics in India. This is about medical crisis, okay? There is one doctor for, you can see the number of breakdown in states as well. What I'm trying to highlight here is the number of professionals available to treat people is so low that one doctor is nearly serving 1 lakh people or more than that. This is in terms of medical doctors, but imagine speech therapy or occupational therapy or physiotherapy, the need. It's a huge need, and the number of professionals providing services is very, very limited. They are mostly based in cities. Bigger cities, more people, more therapists, because that's where they can make more money. Smaller cities, less people, rural places, no therapists. So I just met a family there. The child is 4 years old, is not able to eat, swallow, suck, no speech. We have lost 4 crucial years of intervention with this child, which could have been benefited with services as early as we could have provided services to them. Communication is a very basic need for all human beings. So if you can't see, sometimes it's okay. If you can't walk, it's still okay. But if you can't speak or communicate, it is very, very obvious disability. It can't be seen, but it is a huge disabling factor if I can't communicate. I always say I'm not a speech therapist anymore. I'm a communication specialist. I can teach you how to communicate. I cannot teach you how to speak, because speech doesn't come from here. Speech comes from the brain. And for children that we work with, there is a difficulty with neurological wiring or motor patterns of how their muscles are moving. So we can try our best, we'll get success, but we should be open to other methods of providing therapy and accessing services. I just want you to see some of the statistics that I found again on the internet. Number of speech and language therapists, if you look at in the world, in Australia, there are 5,000 speech and language therapists. In UK, there are 13,767. In Canada, there are 7,000. In USA, which is the biggest, we have over 1 lakh of speech and language therapists, which is still not great. And I don't even know the statistics in India. Somebody told me there is one speech therapist for 10,000 or more than that. I don't have the exact ratio as well. Countries smaller than India sometimes are working in this area and trying to develop the database and getting more therapists on board. So that is a a sad irony of our profession that we don't have enough people providing the services. So I want to talk about what telehealth or teleservices. You all would have heard about the terminology telemedicine. Okay, so you could be sitting somewhere and you could still be delivering your services from a far off place. So telemedicine is an innovative system of healthcare provision for long distance, which uses technology and modern information technologies to communicate with each other. And that is how you could be sitting far away and you could be still doing your therapy with your clients thousands of miles apart. What are some of the trends coming into our field of speech and language therapy that are revolutionizing the way we deliver our therapy? So surgical and humanoid robots are coming into the fields which are doing surgery and doing medical works, and they are also specially developed robots to work with people with autism. And they are working on developing more in that field of smart robotics. Personal medicines are getting more personalized. All of us are having smart watches and body sensors which does our heartbeat and measures our sleep patterns and all those things. A lot of portable diagnostic devices. I talked about rehabilitation robots, gaming. Have you ever thought about using Xboxes for therapy? So in our place, we would use Xbox or any kind of gaming console for therapy because there's a lot of movement. Physiotherapists use it. We use it as a motivation tool. We use it like a reinforcement for them. So we do use a lot of Xboxes and those kind of gaming consoles, which most of the children at this age would like to use and see other people using it. We are also getting something like 3D printing nowadays, which is exactly replication of whatever part is missing, like cleft palate or a lot of other medical conditions where that particular anatomical part is missing. You can actually regenerate that part outside and can fix it back into whatever part is missing. Medical curriculum, some of doctors, I don't know if there's any doctors here, and I think as a rehabilitation specialist, as a speech therapist, I was only taught speech therapy. I wasn't taught psychology. I wasn't taught how to work with parents, families. Coming out of college, I was very young, 22, 23, and I was working with a family of a parent who just had a diagnosis of child with Down syndrome. We were never taught counseling skills. We were never taught how to work with families. All this I learned over my career of 20 years, that it's sometimes the way you talk, what you say to the parents is really what matters. Similarly, in medical doctors coming out of colleges, if they are not trained or sensitized to this issue, they would do it very superficially, and sometimes finding a right medical professional is really, really important. So what I'm saying is there's a need for change in the medical curriculum where more emphasis is put on disability, diagnosing, treatment, what services are available, there are specialization in this field of medical for people with intellectual disabilities. We have a special nursing course, we have a special medical course where people are specifically trained to work with people with Down syndrome. So that's the kind of thing I'm talking about. So if you look at the disabilities, again, this is statistics from US that 36% of the population would have some kind of specific learning disability. Speech and language impairments is 21% of the population will have some kind of speech and language impairment. And when I say speech and language impairment, it could be stuttering, voice problem, it could be language, it could be stroke, it could be... In the morning I said that it's not only Down syndrome where the disability is from birth, but there is so much happening in every place. Like you could be driving, you meet with an accident, falls, injuries, strokes, diabetes. All of these things can actually lead to communication impairments, and technology is really revolutionizing or helping these people across, not only those with Down syndrome. So when you talk about digital health, okay, has anybody used any digital devices to monitor your blood pressure, your gait, your sugar intake? All those things are nowadays with a click of a button. You can actually do all these tests. A doctor could be sitting far away remotely and can get all your results sent to a lab, and that result can be directly sent to the doctor, and he could be providing the services. So in Ireland, they have started a project. It's called, like children find it difficult to go to clinics, there's long waiting times. So they have introduced, like if you go with the insurance company, they have introduced virtual doctors, which means there's a doctor sitting on the other side of the, somewhere far away from the home. You log into the system, You tell them all your symptoms, they might ask you to do certain tests. Those can be done remotely and the reports go directly to the doctor. So the doctor can give you medicines or treat you, not for very severe, serious ailments, but things like fever, cold, cough, ear problems, headaches, all those things which our children can't really communicate well. So they will treat you remotely, and that's really helping a lot of parents, because taking them to medical facilities, waiting, a lot of movement of people, a lot of our children don't like such things, so that kind of facilities are coming up. So when I talk about digital health, I talk about mobile health, apps. We all have plenty of apps on our phone, doing something or helping in our everyday life or showing us the direction, showing us the time. Speech therapy has got numerous apps, and unfortunately in Indian languages we do not have enough apps. So as I was saying it to you that I work for an app development company, and in Hindi we launched first app that helps for vocabulary development for children who have difficulties in identifying a particular vocabulary word. But apps can be used in all other fields of language and speech, and I'll talk about that later. Augmented reality, so using those kind of VR headphones over the eyes and virtually imagining that you are in a particular situation. Sometimes for clients with autism, we would use that to help them to interpret a particular scenario, and they're just wearing the 3D goggles. Social media and networking, we are all on WhatsApp, Skype, and Twitter and all those things. So everybody can get connected, you can find information, you can download photographs, you can download articles, you can be connected to specialists across the world if you can use the social media. And for clinicians like me, I connect with social media on another clinician, we exchange ideas, we exchange clinical information.